Next we have Dr. Shreshtha Sharda. She is here.
Good morning, everyone. So, I'll be presenting on the impact of COVID-19 pandemic lockdown on ophthalmic screening of preterm neonates in Surgery Care Hospital of Uttarakhand. Well, the background of the study was the preterm birth and visual health. It is associated with visual impairment, oculomotor abnormalities, and refractive errors. The cause is due to abrupt visual system to unfamiliar environments. Ophthalmic references ensure early detection and timely intervention for ocular morbidities. So the impact of COVID-19 lockdown, it was a nationwide lockdown from 22nd March to 31st May 2020. So this affected the healthcare services and ophthalmic referrals, both elective and emergency cases. The aim of the study was to assess the impact of COVID-19 lockdown on ophthalmic referrals for preterm neonates born at the institute. The key objectives were to analyze the referral trends before, during, and after lockdown, and to evaluate the changes in preterm births and deliveries, to investigate potential benefits of external environment on gestational age. The methodology used was study design was a cross-sectional analytical hospital-based study. The study period was from January 2020 to July 2020. The inclusion criteria was preterm neonates born in the hospital. They were screened for who was screened for ophthalmic issues. They were screened for ophthalmic issues. According to WHO guidelines, the preterm were from the age group of less than 37 weeks gestation. The preterm categories were extremely preterm was less than 28 weeks, very preterm 28 to 32 weeks, and moderate to late preterm 32 to 37 weeks. The exclusion criteria included was the infants more than 1 month of age or who were born elsewhere. Unbooked emergency births, like who were delivered at the hospital due to lockdown, were also analyzed for comparison. Screening tools and focus used were torchlight, direct and indirect ophthalmoscope, and they were screened for congenital abnormalities, red eye, or systemic pathologies. The study periods included the pre-lockdown period, lockdown period, and post-lockdown till 31st July 2020. The results were in the table, as we can see, the OPD and IPD trends in the eye department in 2020. The observation, as we can see that in May, we recorded the lowest IPD occupancy at 4.0%, 0.3%, as compared to, for example, in January, which was 87.03%. And then the overall reduction, the both OPD visits and admitted patients across the month of May. And then again, there was a rise in July post-COVID, around 12 to 25% when it was increasing. It started to increase again. Here we can see the monthly distribution of ophthalmic references. We can see in May had the lowest percentage of booked preterms, that is 0.99% of deliveries, and only 6.38% of preterm births were booked, indicating a decrease in the preterm follow-ups. And again, we can see, for example, in January, it was 5.79%, and then it decreased to 0.99% in May. And again, the trend started to rise in July, like 3.93%. In the ophthalmic screening in lockdown period, in the year 2019 versus 2020, we observed that there was a significant decrease in booked preterms during the lockdown, and the preterm births reduced significantly, suggesting conversion of the term births among those with regular antenatal care. And the last table, we observe that there was no, in the average gestation of preterms in 2020, there was no significant difference in gestational age across the three phases, that is pre, during, and post-lockdown. Discussion, the impact of COVID-19 lockdown, there was a decline in ophthalmic services and preterm births which were observed. In global preterm risks, we see that prematurity causes visual impairments with stress, sleep deprivation, and periodontal diseases as a key factor. Ethnicity affects birth rates but not the outcomes. Ophthalmic issues in preterms, high risk of ROP, as we all know, strabismus and visual deficits require long-term monitoring. And COVID-19 and eye health. The COVID-19 linked to conjunctival symptoms, but no vertical transmission found. Breastfeeding was allowed with masks. Limitations and conclusions. The limitations, we see that the findings reflect the perspective of ophthalmologists only. More facets need exploration to form a comprehensive hypothesis. Limited follow-up data on long-term outcomes of preterm births during lockdown. The conclusion of the lockdown led to a decline in the ophthalmic references, including preterm screening. There was a decline indicating a positive shift towards the deliveries. The study provides a unique perspective on external stimuli influencing antenatal outcomes. Further research is required to determine if this trend was nationwide. The key message and future directions. Primordial prevention of ocular anomalies is essential. Environmental changes can result in favorable pregnancy outcomes. Future research, broader studies on external factors and preterms can be studied. These are my references.